Good afternoon, and welcome to a conversation on the coronavirus crisis through gender, environmental, anthropological, and indigenous lenses. My name is Asher Kaufman, and I am the director of the Kroc Institute for International Peace Studies. COVID has impacted our lives, our communities, and our well-being hard and fast. Only a month ago, in the US, we were still operating somewhat normally. The University of Notre Dame was open for business, and we were still offering classes on campus. A month later, and we are a world apart from this reality. But COVID has not impacted us all equally. In fact, it is clear that this virus is not a great equalizer, but quite the contrary. It is affecting groups of people differently based on their socioeconomic, ethnic, and legal background here in the US and elsewhere in the world, as well as based on the resilience and effectiveness of the public health systems in their own communities. As a Peace Institute, we at Kroc have been focusing on structural conditions of inequality long before this crisis dominated our lives. We thought it would be beneficial to invite some of our faculty and the graduate students who work on themes that are relevant for the understanding of the impact of this pandemic on marginalized groups, as well as on the environment. We are grateful for the many people who signed up for this conversation, and we hope that this is the first out of more conversations we would have at the Kroc Institute on this crisis and its current and future impact on our lives from the perspective of justice and peace. With us today are Catherine Bolten, Associate Professor of Anthropology and Peace Studies, with extensive research and advocacy experience on the Ebola epidemic in Sierra Leone and elsewhere in Africa, and who is already conducting preliminary research on the effects of COVID in Sierra Leone. Ashley Bohrer, Assistant Professor of Gender and Peace Studies, a scholar and activist working on the nexus between oppression and exploitation through the lens of intersectionality. Justin De Leon, visiting research fellow at the Kroc Institute, a scholar and activist working with the Native Americans and more broadly in the field of Indigenous studies. And Drew Marcantonio, doctoral candidate in Anthropology and Peace Studies, working on the concept of environmental violence and the process by which humans are harmed by human-produced toxic and non-toxic pollution. I'll start with Kat Bolten. Kat, you have been working on the Ebola crisis in Sierra Leone and in Africa, and I'm sure you have some points of reference in terms of comparing between the two cases, particularly with regards to information, misinformation, disinformation that is out there today. Could you share with us some of your thoughts on that?
Sure, thank you so much, Asher. So what unfolded during the Ebola crisis in West Africa is that it is clear that people either trust, accept, and act on information that they receive about a virus or a public health emergency, or they mistrust it and can potentially choose to ignore or even contravene the advice that's given to them. And one of the things that's vital to do early in an epidemic is to figure out what sources of information people trust, why they might listen to those sources of information as opposed to any others. And then you can see how it is that people act on the evidence that presents itself in their worlds as to what this epidemic actually is. In the case of Ebola, you had nations with a long history of slavery, internal warfare, government corruption, and mistrust of official government pronouncements, which meant that what you saw across the region were people who were initially very, very reticent to accept information campaigns, education campaigns, and outreach campaigns. And this actually provoked the spread of Ebola in ways that otherwise would not have happened if people had trusted their governments and embraced what they had to say. What you're seeing with COVID-19 is actually very similar. When you have a lack of information about what a virus is, what it does, and how fast it spreads, or you have a lack of reliable information, perhaps you're getting competing stories about what this is, or a lack of a reliable source of information, whoever it is that's promulgating the information is deemed to be untrustworthy, you will find very different reactions to assumptions about what this virus is, what it does, and what the future actually holds. One of the things that we're finding that's shared in common with the Ebola epidemic and COVID-19 is the rise of conspiracy theories surrounding the origin of the virus. The fact that bioterrorism, that these were both viruses that were developed in laboratories and unleashed on populations as an experiment, has occurred in both cases. And what this shows us is that there's vast distrust around the world for what warfare will actually look like in the future, that it might not be people taking up guns, but governments actually waging war on each other's populations by unleashing viruses in them. And bioterrorism conspiracy theories emerge from every different direction. Early in the crisis, you saw that this was a theory that China was, accidentally unleashed a bioweapon that was meant for America on its own population, and therefore had to suppress what was actually happening in the country in order to kind of cover up their mistake. This lens was reversed when the US sort of conspiracy propaganda machine started to take hold, that this was actually a US conspiracy against China. And so what you see emerging from all of this, what we can learn about human populations, especially in the US, is a sort of large-scale distrust of government. And this occurs on both sides. It's not just right-wing conspiracy theorists. You also have left-wing conspiracy theorists. There are those who refuse to self-isolate, particularly because they thought the government was actually trying to erode democratic freedoms and using this crisis as a way of instituting authoritarian and perhaps even fascist control. And so what you get in a time of conflicting misinformation or competing sources of information is that people will actually kind of retreat into their ideologies and worldviews and start to only interpret what they're seeing through the lens of what's comfortable for them. And what this is doing is actually revealing the depths of the political and social divides in the US.
Thank you. Thank you very much, Kat. I would like to have Justin perhaps share with us his own thoughts about one particular group in the US, Native Americans, and their effect and their dealing with this challenge of COVID-19. Justin, the floor is yours.
Thank you, and hello, everyone. I'm glad that, Asher, you had mentioned that the virus is not an equalizer. And then, Kat, I'm also glad that you emphasized this idea of trust. What we know is that the virus is not, it doesn't have preferences, but access to healthcare and resources do have preferential outcomes or treatments. So I was having a conversation earlier with Kyle White, who's a Potawatomi gentleman from Michigan State, and we were talking about how the framing of this as a war rhetoric or as a crisis rhetoric, or even as suggested, this bioterrorism, can be actually a dangerous thing that could leave people more vulnerable than they already are. So when one frames this issue as a war rhetoric, then it demands immediate action. And I think the challenge with Native communities in the United States is that the relationships of trust, of reciprocity, of say kinship, of communication haven't been there historically. So when you have this immediate need and you don't have the relationships of trust, that's a recipe for disaster or further vulnerabilities. And so let me just put that in further context. In the United States, there's some 570 federally recognized tribes, and there's hundreds of non-recognized tribes as well, each with their own unique configuration of sovereignty with the US government and a relationship with the US government. And by design, those relationships are limited, they're delimited, right? It's what some people call a sovereignty produced by colonialism. So it's complex, it's bureaucratic, it's difficult to get resources here and there, and often it's very marginalized. And that was before this COVID-19. So then on top of this, as we've seen in the last handful of years, there's also these mitigating interests or mitigating industries, you'd say farmers trying to take land from native people. You could also say the extractive oil industry. You don't have to look too far just to Standing Rock recently with the Dakota Access Pipeline to see that there's other entities that are trying to come in and extract and further make these communities vulnerable. So that's the context. Now, when it comes to resource distribution, healthcare is part of that. And so historically, healthcare on reservations have also been very taxed and very spread thin. Of course, because there's 570 plus you'd say tribes in the United States, that's all varied. But what isn't disputed is that a lot of folks in Native studies talk about how Native communities act as a microcosm for really you'd say the most extractive or the worst US policies. There's been studies that shown that Nazi Germany was studying American policies of expansion westward and cordoning off Native people into reservations to see how they also can cordon off their folks that they didn't want in their own community. So it's really interesting to see what happens to the vulnerable folks on reservation and how that can actually impact greater policy. Fortunately, in the United States, Native communities have not been impacted significantly yet, except for the Navajo Nation, which is down in Arizona, New Mexico, bordering Colorado, and also Utah. And part of this was because of the swine flu 10 plus 12 years ago. It disproportionately impacted Native people. So when this started coming about, a lot of tribes started taking proactive measures to really cut off any coming in or coming out in their communities. Just in the last few weeks, there's been curfews on a lot of the Lakota territories in North and South Dakota, which I work with closely. And as I had mentioned, the Navajo reservation is hit the hardest. So I would say an interesting thing here to think about is how intersecting injustices are overlapping and creating even bigger pockets of vulnerability. So on the Navajo reservation, it's the size of Massachusetts, New Hampshire, and Vermont combined, and there's only about a dozen grocery stores on that entire reservation, which means that in order to get food, you're traveling an hour, hour and a half just to get those essentials, which means that you're placing yourself at risk, right? Encountering folks from the city and so on and so forth. So about 3 weeks ago, the Navajo Nation had their first case. And in 3 weeks, it's gone up to about 700 cases. And this last weekend had the most cases arise. There's been about 24 deaths in the Navajo Nation. And the governance system there is struggling to convert schools into hospitals and also to talk to federal agencies to get more ventilators and more equipment. So they've been also on lockdown. And what we've seen, similar to in urban areas and almost all over the United States and in the South, is that this is impacting vulnerable populations, people of color, Indigenous people, at a greater rate, at a disproportionate rate than other Americans in the United States. And I would suggest, again, it's those overlapping, intersecting vulnerabilities. Globally, there's some things to be aware about. In Brazil, the first Indigenous person who was a teenager has died just this weekend of COVID-19, and that was in the Amazon. And so there's a lot of fear that it could spread amongst Indigenous peoples there. Aboriginal peoples in Australia, 2 weeks ago, they had the Doctors Association had to put out a guideline that said you can't be prejudiced towards Aboriginal folks because it would actually cost a lot of lives. And we've seen a lot of cases where Aboriginal folks are not given treatment there in Australia. So basically, if I were to summarize, it's a very dangerous situation, I think, for Indigenous peoples here in the United States. And that's not just because of this virus, but that's because of this historical history of not having just relationships. Then on top of that, I would also caution to frame this as an immediate war rhetoric, war crisis. Because if that's the case, it actually marginalizes consultation, buy-in, and relationships even more than before, which could also open up more vulnerabilities.
Thank you. Thank you very much, Justin. So I think we have begun speaking about the fact that Indeed, this is not an equalizer. In fact, it is exposing existing structural conditions in the United States and elsewhere, exposing structural weaknesses within our societies. And that brings me to ask you, Ashley, if you could introduce to our conversation questions of gender and race and how they play out in this pandemic.
Yeah, thanks, Asher. So I think when I'm thinking about existing inequalities and oppressions playing out in the context of this pandemic, I think about them in two ways. And one is about the unequal distribution of vulnerability that the virus is exposing, sort of unequal distribution of vulnerability that has already been the structure of the US and the global world for quite some time. And then the other way I think about it is about the unequal distribution of responsibility in response to the crisis. And so when I think about an unequal distribution of, for example, gendered vulnerability, one of the ways we might think about this is in the disproportionate feminization of frontline workers. So, for example, nurses, those who are doing elder care, those who are continuing to provide childcare, those who work in food service preparation and in service sector industries tend to be overwhelmingly female. They tend to be overwhelmingly working class, and they also tend in the United States to be overwhelmingly people of color. And what that means is that those essential workers, many of whom tend to be poorly remunerated, who lack benefits and job security, especially in places like right-to-work states, are continuing to be relied on as the most essential frontline workers. And yet that status is also continuing to produce them as more vulnerable to contracting the crisis, contracting the virus, not contracting the crisis, contracting the virus, in ways that are disproportionate, right, or are not equally distributed across jobs and sectors in the economy and the workplace. Another way we might think about gendered vulnerability is not just in vulnerability of exposure, but also some gendered effects of some of the sort of shared vulnerabilities. So for example, we've seen, the highest spike in unemployment in United States history these last few weeks. That's obviously a phenomenon that is not gender specific, though it is especially class and race inflected. But there are gendered effects to things like unemployment. So for example, gender-based harm in the home, including domestic violence and intimate partner violence, tends to massively increase when there is financial strain. And that means that all of the sort of shelter-in-place orders that are using language that suggests that the home is the safest place you can be right now is actually especially for those who are in violent partnerships or who live in violent homes, who tend to be overwhelmingly women and queer people, may not experience the safety of the home in the same way as other people. One of the other things that's happened actually to further thinking about these gendered effects is the way in which the inability to pay rent has played out in the beginning weeks of April. So on April 1st, only about 69% of Americans were able to make their April rent payment. Again, that's a pretty gender undifferentiated statistic. But what has the response been? The response has been that in many states, landlords have begun pressuring their female tenants to exchange sex in lieu of rent payments. And in fact, this problem was so severe that the Hawaii State Commission on the Status of Women had to create an official government guide for what to do if your landlord is pressuring you to exchange sex for rent. And this is obviously not a problem that is confined to Hawaii, but what I think it rose to the level of having an entire government commission create a document. And so part of what this suggests to me is that there are already existing inequalities, hierarchies, and structures of domination that mean that whenever there are even non-gender patterned effects of this virus, the way that they are felt and lived and interpreted and some of their subsequent effects can have highly gendered, highly raced, and highly classed effects. I think we can see that also if we look at the way that coronavirus has affected houseless populations in the United States. There are about 13.6 million people who currently lack access to stable housing, making the shelter in place rules significantly more challenging to meet. And about 84% of houseless people with children are single mothers. So there's a massively gendered distribution in how houselessness, especially houseless families, are structured. And to sort of increase talking about some of these vulnerabilities, an overwhelming percentage, over 90% of houseless women experience sexual assault over the course of their lives. So when we're thinking about both the shelter-in-place orders and the way that increasing precarity and economic vulnerability impacts various populations, we see that it is those who are already the most vulnerable who continue to experience the harshest effects and the fewest protections. Sort of moving from thinking about gendered vulnerability or an unequal distribution of vulnerability, I think another thing to think about or talk about is the unequal responsibilities that some aspects of the crisis have brought into the fore. And in particular, when I'm thinking about the gendered effects of this responsibility, I'm thinking about the domestic and emotional labor toll that, centuries of associating domestic labor and emotional labor with feminization has created a situation in which there's a gendered distribution of home tasks for those who are at home. Even in households where there are two working partners, every single study that's ever been done basically shows that women take on a massively higher responsibility for childcare, for meal prep, for house cleaning, for laundry. And what we're seeing in this crisis is the continuation of those patterns that are now exacerbated by the fact that children are at home and not in school, and that meals need to be prepped at least 3 times a day. If you're me, you also need snacks 3 to 6 times a day in addition to those 3 meals. And so part of what's happening is that in addition to a gender distribution of vulnerability, we're also seeing the responsibility for responding to the new conditions disproportionately devolve onto the shoulders of those who have already been constructed as naturalized for care work. And the history of care work being gendered as well as racialized is significant and continues to inframe the way that households and cities expect the household as a unit to respond to some of the new responsibilities that are taking place in the home rather than outside of it. I'll stop there.
Thank you very much, Ashley. You raised many charged points, and I'm sure we will return to some of them at least in the second round of questions and your answers. I would like to move to Drew and introduce the environment to our conversation. Drew, you have been working in your dissertation on violence and the environment, and I wonder if you can share with us your thoughts about the effect on COVID-19 on the environment.
Absolutely. Thank you, Asher. And to do this, I'm going to share with everyone a PowerPoint that I put together because I have a significant amount of data to share. So I hope this comes up properly. Asher, if you can confirm for me that it shares with you, just because I can't see it. Is that?
Yes.
Okay, perfect. So what I'll be talking about today is the comparisons and connections between COVID-19 and environmental violence. I apologize, I'll be speaking a little bit fast. If you'd like this data shared with you, I'm more than happy to send it to you and to share with you all of the resources where this data is drawn from. But bottom line up front, oh, it skipped on me. Where does that go? Bottom line up front, we need to start thinking strategically about shaping and orienting on human-caused environmental risks instead of relying on short-term and stopgap tactical decision-making, as extreme events from extreme weather to disease pandemics like we're experiencing now are only going to increase in the coming decades. And to do this will require a reflection on our values and what we value and a restructuring of the contemporary human niche, as a lot of the data that I'm about to show you will point to. So a definition for environmental violence, because this isn't present in the literature yet, but the way I think about it is direct and indirect harm experienced by humans due to human-produced toxic and non-toxic pollutants that are emitted into the Earth system. And it's important to think of toxic and non-toxic, which are separate processes. So climate change and environmental pollution, or environmental toxic pollution, have very different processes, whereas toxic pollution works directly on the body. Non-toxic pollution, such as greenhouse gas emissions, drive climate change and other events, other types of phenomena that then act on the body and are all mediated, both are mediated significantly by different social pathways. So thinking about human-produced toxic pollution first, if we look globally, it is the single largest source of human-caused death. Roughly about 8 to 9 million people per year die early as a function of toxic pollution. Importantly, that is a very conservative estimate. It doesn't even include the things that I tend to look at in most of my dissertation work, which is tracking like chromium, cadmium, mercury, things that you find in mining tailings, that sort of stuff. None of that is included in here, though lead is. And yet we're still getting 8 to 9 million people per year dying globally. 92% of those deaths are in low and middle income countries, and even within rich countries, that tends to be in poor neighborhoods or poor people that are dying at the highest rates. Some of the other sources of death you look at are tobacco use is almost comparable to pollution, but then the next highest one is only about 3.5 million. So we're seeing that significantly more people are dying as a function of human-produced just toxic pollution than all other causes of death. Okay. And some of those sources of that we've seen traditionally, you see in the graph in the bottom left, like indoor air pollution, so think cooking fire in the home, had been a leading cause of pollution deaths. Those have decreases because of alternative energy sources that have been made available, think electricity, et cetera. But because of new forms or modern forms of pollution that we're seeing increases, I think, of industrial pollution, we're seeing significantly larger numbers of people dying. But it's not just death, right? So you also have disabilities, morbidity that's caused from that, and all sorts of other things. One way for accounting for that is called a disability adjusted life years. So depending on what you might have, so asthma gets a value of 0.3. So for every year you live with extreme asthma, you lose a third of a year, and that's measured. Dementia, a sixth of a year, or 60% of a year. So in total, about 275 million life years lost per year as a function of toxic pollution. And even though that might have issues in how it's calculated, it's a good thing to then take and compare to other ways people are dying. You'll see it's the single largest source of disability adjusted life years lost. So it's a good comparison value, even if the calculation of itself might be questionable. So then if we think about toxic pollution and the global distribution of it, annual toxic pollution deaths, as I mentioned, about 8 to 9 million per year. Total number of people dying about 55 million per year. So in China, for example, 1.8 million people die as a function of toxic pollution per year. The United States, about 200,000. In China, that means 5,000 per day, and the US, 540. And then if you look at the total number of COVID deaths as of yesterday anyways, it's about 3,300 in China, though there's significant questions about the validity of that data for different reasons. And then within the United States, about 22,000. So that's in about a 3.5 month period from the start of both, and the total numbers that we're seeing. And then, yeah. We'll move to the next slide. So it just gives you an idea of the global distribution of toxic pollution. Now, if we move to non-toxic pollution, there's different pathways that are at play here because, right, greenhouse gas emissions change atmospheric composition. Atmospheric composition then has multiple different phenomena, including climate change, including warming, extreme weather events, all different pathways, right? But the number of people who are being impacted by extreme weather events is significantly increasing. That's the graph in the top left that you see. So it tends to be a trend over the last 25 years. even greater if you go back further, but this is some of the most robust data for at least the last 25 years. Significant increase in number of people exposed. In the bottom left, this is one staple crop. There's about 5 staple crops. You can include wheat, soybean, rice, etc. All of them decreasing in total productivity per unit of land in production because of warming, so it slows the seed maturation period, which means that we have significantly less produced per acre, which means then you have to put more land in use per acre, which is also kind of a bad thing given the amount of global food waste, which is about 30% in the US, 40% globally of food produced that is wasted. And then you have a decrease in the amount that can be produced. In the top right, we also see that warming affects the ability for labor, particularly outdoor labor, which tends to be low to middle class labor. And these will be disproportionately affected because of heat injuries, inability to work in the heat, et cetera. So we see a decreased total amount of labor productivity globally just as a function of warming. And then the amount of deaths, this is only one subset, right? So we have 5 indicators: undernutrition, malaria, dengue, diarrheal disease, and heat. And these projections include interventions in reducing this phenomena of each of these. But just by 2030, 10 years from now, right, 2030, the expectation is that there'll be 240 additional deaths per year just as a function of climate change in these 5 indicators. All right, so if we look at some of the connections between COVID-19, even though there's many ways that they're connected in what I already presented, some of the direct connections between COVID-19 and toxic pollution emissions and non-toxic pollution emissions. If you look on the left side, we can see as a function of decreased mobility from stay-at-home orders, et cetera, a significant decrease of about 35% reduction in nitrogen dioxide, which is a significant respiratory irritant in the Northeast seaboard. So you have March 2015 and 2019 average for March, and then on the bottom graph is March 2020, significant reduction, which is good, cleaner air for people to breathe, although obviously not the way that we want to achieve this. But then on the right, you see the same thing for NO2 emissions in China. It was about an 80% reduction given the drastic measures taken there to reduce mobility. The graph below that is in particulate matter. Particulate matter is one of the leading killers as far as air pollution goes. It's about 6 to 7 million people per year. And in the next slide, we'll see another connection between it and COVID. But just from reductions in particulate matter across China from response to COVID-19, you saw 73,000 reduced deaths in people over the age of 70 and an estimated 4,000 reduced deaths for children under the age of 5. And those are very conservative estimates. I can show you how those were produced, but that's the number of lives expected to save just from reducing mobility. So it shows what we can do with different changes. All right, so the frequency of epidemics or the occurrence of them is also expected to increase as a function of climate change. So what we're seeing today is likely, for many other reasons too, habitat overlap or habitat destruction and fracturing, et cetera, is very significant or high probability that we're going to see increased rates of these type of events in the future. It's also at a 20 to 50% increase, and that doesn't even include several other ways in which that we're increasing the probability. This is just one limited estimate of about 20 to 50% over the next century, or a 20 to 50% increase in probability. This is a study that was done here in the US at the Chan School of Public Health at Harvard that took data from 98% of all US counties and all the COVID death data to date as of when they released this, was 2.5 weeks ago. And it showed a statistically significant evidence that there's with a 1 unit increase, which is 1 micron, where 1 unit for them is 1 micron per cubic meter, which to kind of give you an idea, if you look at different cities in the US, 1 standard deviation change is 17 microns. So we have a significant ability to shift between one area to another, which means that 1 unit change is likely going to be or you're going to see significant changes over areas. So that 15% corresponding change in percentage, you could have an area very easily that has a 300% increase of somebody dying as a function of being affected from COVID due to their exposure to PM. Which tends to be poor people and in poor countries, but even in rich countries, the poor people in those and in dense urban areas more often than not. Yet there's these massive incongruities, right? So everyone's seen these kind of signs when you go to the grocery store. Milk unaccessible, eggs unaccessible. Yet in the US, they're pouring out 3.7 million gallons of milk every day because they have an inability to be able to move it. How is it that our niche is structured such that this is the case, right? Or that a chicken processor is having to literally crush 750,000 eggs every week, and you can't get it at the grocery store. So this kind of points to the lack of, or the fragility of our current system with all of our different moving pieces and what have you. We can talk more of that in a bit. But if we look at future trajectories, everyone's kind of thinking, well, hey, isn't this great that we're reducing all this pollution, et cetera? not so good. As we see, protectionist concerns for the economies are, if you will, trumping all other concerns. So you look at Brazil, for example, they're having significant reduced amounts of enforcement of deforestation across the Amazon. In the US, they say this open license to pollute. Literally, the EPA set out that they will not fine anybody who exceeds their pollution permit, since backdating it to March 13th. Any company that exceeds their permit will not be fined. So anyone can pollute as much as they want past their permit, and it doesn't matter. The EPA will not assess fines for that. And even though we have a significant reduction in global air pollution already in China, they've exceeded now what they would normally be producing in emissions today. So trying to make up for this lost period. So there's this massive concern for a rebound effect. And I'll stop there. Sorry.
Thank you. Thank you very much, Drew, for bringing in the environment and its effect on this current crisis. We received many questions from some of our listeners, and I will read some of these questions and invite our panelists to respond to these questions. The questions that we received could be grouped into several categories. One category is clearly an interest to explore further the question of marginalized, vulnerable groups in the United States and elsewhere, and the effect of this crisis on them, including questions of policy. Policy that could be addressed, that could be directed particularly to address this challenge. Other questions related to the environment, other questions related to our social habits that have changed in the last month, and a big question of how would be able to return to normalcy, and what would normalcy look like after this crisis. But I would like us to perhaps start with the question of marginalized groups or particular groups that have been strongly affected by this crisis. And I'll read one or two questions and then address the panelists. One question comes from Nicole Guerin. How can public health officials, policymakers better target their messaging to account for racial and socioeconomic health disparities? She provides an example of her community in Detroit, where African Americans make up a disproportionate share of coronavirus deaths. And she asks, how could a better understanding of intersectionality improve the public policy response in Detroit and other US cities? Another question that comes from Samantha Garcia: how do you believe the coronavirus pandemic will affect socioeconomic inequality in the United States? These two questions reflect many other questions that we received from listeners, as I said, with this particular interest in groups that are disproportionately affected by this crisis. Perhaps we can start with Ashley and trying to answer these questions.
Sure. Thank you for both of those questions. I think the first thing to say is that I think there is no possibility of mitigating the differential impact of coronavirus on various communities without alleviating the disproportionate sort of the existing inequalities and hierarchies and oppressions that structure every single aspect of American society. I think part of what this crisis is exposing is what normal already looked like, and normal had already looked like differential exposure to death and violence and poor health outcomes, lack of access to basic institutions, and the fulfillment of basic human needs. So I think what intersectionality allows us to see and to understand is how groups that have differential access to power are constituted in a multiplicity of ways, and that we need to be thinking strategically and comprehensively, not just about one axis or another, not just about race, but about gender, sexuality, class, incarceration status, immigration status, and many more things together in order to move toward a society in which, as Drew said, these pandemics are likely to become more frequent. And so I think what intersectionality, or the urgent question that intersectionality opens for us, is how to make sure that we are rebuilding social life in a comprehensively equitable way, such that the increasing frequency of these crises do not continue to impact the already most marginalized in the most violent ways.
Thank you, Ashley. Kat, please share your wisdom with us.
Well, one thing that struck me about this question is in what ways can this public health messaging be more relevant? And I would say that one reason that a lot of it is either ignored or rejected is because it assumes a middle-class office worker identity for just about everyone in the US. And this idea that you can shelter in place, work from home, and limit your grocery shopping to once every 2 weeks assumes an income that will allow you to shop in bulk for 2 weeks at a time. It assumes that you have a job that you can do from home, and it assumes that you don't take public transportation anywhere. And so when the messaging is essentially, it doesn't actually include a large proportion of the American population, not only are they going to say, this isn't for me, but they're going to say, I can't actually live my life this way. So it becomes irrelevant because it doesn't actually take their needs into account. What does social distancing look like, in a household that has 9 people living in it? What does living on a budget by which you shop for 2 weeks look like when you are feeding 4 children on food stamps? These things become impossible, so that the messaging itself is actually, insulting to a lot of the people who don't have the ability to accept it. And so it's not just a matter of, can we create a more equitable health system? It's how is it that we're ignoring, the 69% of the American population that couldn't pay their rent last month by saying you should shelter in place and work from home.
So what kind of messaging are you proposing that would be different?
I mean, the messaging has to be kind of undergirded by the fact that, an understanding of the fact that not every, most Americans don't live this sort of middle-class office lifestyle. There was recently an article in the New York Times that was sort of saying, look, the southern states aren't social distancing. It's, they don't have social distancing orders in place. And we're tracking this via the number of miles that are typically driven every day in these states. But what was noted by another commentator is that in a lot of these states, people live in rural areas or they live in food deserts. And so actually going to the grocery store requires that one travel 10, 15, sometimes 20 miles. And so assuming that people are just sort of rejecting your order to stay in place because they don't like what you're saying kind of undermines the fact that, aspects of daily living are much harder than they are for office workers who can save the nation by having, food delivered to their door every night. And so this idea of the heroic American who's staying in place, working from home, getting takeout, supporting businesses in all of these ways, actually erases the experiences of a large proportion of the American population. And the messaging needs to actually shift to say, we understand that you can't pay your rent. We understand that you have to get in your car every couple of days to go find food because the money doesn't come in larger amounts than that. It has to actually understand the experiences of a vast majority of Americans.
Which is also, just to piggyback off of what Kat said, is to say that I don't think this problem can be solved at the level of messaging. It actually needs to be solved in holistic, comprehensive policy solutions that would do things like suspend rent while 9 million Americans are unemployed, and would do things like alleviate the problem of food deserts. And I think part of what it means to understand that people live in different situations and have different needs also means that we have to create policies that eliminate some of the underlying structural conditions that make accessing healthcare and safe food and safe housing possible only for a very privileged segment of the American population.
Right. Justin, you want to do? Go
yeah,
ahead,
if I could speak, maybe not so much on mitigation strategies or messages, but maybe I would talk about opportunity and thinking about this idea of the possibility of rebuilding social life. In 1760s, the US government gave blankets that had smallpox to Native peoples. There was a Native genocide, there's been massacres, 400 years of slavery, prejudice, mass incarceration. I think it's fair to say that if we're here today, whether we're people of color, Native, Indigenous, or just anyone here today, you can say that you come from hardy stock, right? That everyone here comes from families and ancestors who persevered through difficult times, whether it was previous pandemics, world wars, and so on and so forth. So that should give us a lot of confidence to know that we do have the power to change those social lives, those aspects of social life that have not served all of the American population, if we're able to step up and be brave enough. And so I was having a conversation a few months ago with a colleague named Jordan Bighorn, and he's a Lakota gentleman, and we were talking about how there was this external migration to the United States because there was this material opportunity and prosperity for coming here. And maybe what's now is needed, and which could potentially be quickened by this pandemic, is instead of an external migration, maybe there's this internal migration, right? Instead of migration of the external life, material prosperity, now we're talking about this internal migration. And when you look to Indigenous peoples around the world, one of the main organizing principles, which I mentioned previously, is around relationships, but genuine relationships of trust. And this is where I think when we think of the current structures in the United States, whether it's first to the finish, whether it's majority rules, Roger rules, and all of this, Roger's rules of order, those aren't really conducive to generating relationships of trust. Matter of fact, a lot of those conventions further marginalize vulnerable peoples. So to me, I'm thinking not so much about mitigation, but about that opportunity. What type of opportunities does this allow us to put forward where we can start asking questions? Do our collaborations, do our writings, do our policies that we're creating, do our consultations actually build trust and actually build reciprocity? Are we empowering or are we disempowering? Who's at the table? And how do we actually get at some of those things that we've all talked about, which are these intersecting, overlapping, historical realities of mistrust? We have a chance to rebuild. I think that we have a chance to think about what it means to live in relationship.
Yeah, and that addresses, I think, some of the issues that Kat and Ashley spoke about with regards to both messaging, but also the actual work on building relationship from the bottom up in order to address some of the structural conditions that all of you have spoken about. I would like to, we don't have a lot of time, I would like to bring the environment back into our conversation. That was a theme that came back in time and again in the questions that were posed to us. And Drew, from your presentation, I mean, you left with a mixed feeling of, on the one hand, we all acknowledge the benefits of this lack of mobility that we have been experiencing over a month now, and perhaps over 3 months in large parts of the world. You only need to go step outside and look out your window to see the effect. It has immediate physical appearance. The air looks cleaner, and you have given us some data that shows the effect on, more dramatic effect on actual casualties, humans whose lives is saved as a result of this global stay home policies. I mean, I'm thinking about, and the questions that we received was, how can we actually move forward to a post-coronavirus era and retain some of these benefits that we are now seeing the positive effects of it? And it's hard to think about this crisis from the perspective of positive effects, obviously. And I'm not trying to reduce the gravity of the crisis, but perhaps you can address that issue.
Absolutely, and I think you're right, though, there is some positive to be seen, but the question is, how do we transition that energy forward? We've seen what can happen if we're willing to take drastic policy steps to help reduce human suffering. In this case, human suffering caused by COVID, but as I demonstrated, there's significant amounts of other human suffering exist, and as everyone here has talked about, that exist in different ways that can also be alleviated if we're willing to make just as drastic of policies, hopefully more strategic than tactical, but or short-sighted or short-term, I should say, but willing to take those steps. So, you know, and we're starting to see, though, that the predictions by the IMF, for example, are that this is going to be, the economic impact of this is going to be as strong as the Great Depression of the 1930s. And so that pushes a lot of people to be concerned of the economics of this, as it should, because the people that are suffering most as a function of the economics are the poor, who already are living on the margin or do not have any sort of savings to deal with these issues, as Kat spoke about very clearly. But there are many ways that this has forced us to look at the practices that we undertake in our everyday lives. I would, you know, I assume probably that most of the people on here have taken at least one flight in the last year. About 76% of the world's population on the planet currently will not take a single flight in their entire lives. Right? The rejected energy in the US, so from all energy that is produced, and specific to the US, all of the energy that we produce, only about 30% of it actually ends up being put to human use. The rest is wasted. Globally, it's about 65%. So significant energy waste that happen as a function of our current living. And then commuting, specific to the US, the average one-way commute in the US is 26 minutes. That works out to about 200 hours in the year. So there's many, many small ways in the short term that we can look to restructure our lives, things that have been cut out of our lives recently in a very forcible way. But we need to start thinking about how do we do that in a planned way, because they need to come out if we're going to have a sustainable future. And I would consider those even short-term aspects, because that doesn't, even if we cut out portions of those, so flying, for example, only accounts for 6% of all greenhouse gas emissions from all human sources. Electricity is another one of the larger sources at about 30%, and then transportation about 17%. That's still collectively only about half of the total emissions from humans. But this is an opportunity to think about what can we use less of. But there's also been a lot of examples of pushback on it. So the Paris Climate Agreement, when it was passed, many people within the French population were very, very proud of what happened in Paris. Yet the fuel tax that was instituted immediately afterwards, that was supposed to be in place for France to achieve its emissions that they said that they would reduce for the Paris Climate Agreement, incited the Yellow Vest riots, and that fuel tax was removed, and they're not on track to reach their emissions. So that was an example of a point in time when there could have been an opportunity sparked by the energy of that. Here we have an opportunity that could be sparked by the energy of seeing the ways that the environment is becoming cleaner as a function of our choices. But as I showed in this PowerPoint, I think there's a lot of things already happening that are working against that. So we have to really find ways to look more towards community, towards using less, like many of the things that Justin pointed to very clearly, in building trust with each other, building community with each other, looking at ways to reduce other forms of human suffering and inequality that already exist and that are exacerbated by environmental issues, but are all interconnected, and try and make this an opportunity for change. Like I said, I'm not hopeful given the current signs.
Thank you very much, Drew. So some of the questions that were raised were about the day after. How would our life look like the day after, assuming that there is, a day after? How much of our life would be impacted by this change for the better or for the worse? Is this actually an opportunity for introducing drastic changes in our human behavior, in socioeconomic activities? Is this an opportunity to challenge, the neoliberal economy that has dominated our life in the last 100 years or so? So I'm inviting you to think about these questions. Kat, if you want to think with us about this.
Yeah, I think partly that question also comes from a place of privilege, because it's about lessons learned rather than I'm still unemployed, I still can't pay my rent. Now that this is over, I'm now risking eviction. and all of these questions about how long we will have millions of people unemployed. So this idea of normal, or what comes after, I think is very fraught with respect to, oh, I go to my office instead of staying home and working, or wasn't it nice to be able to spend time in my garden? I think I'll do a little bit more of that. And as a question about changes in behaviors, again, are sort of a luxury that can be directed at the middle class. I think, what does the day after look like for millions and millions of people in the US? It's just still a sort of black uncertainty, because there's no real sense of, how this tiny temporary stimulus package, might impact people in the long term. $1,200 doesn't go very far if you're living in a major city. It might keep food on the table for another 2 weeks, but there's nothing about the economic stimulus that actually is able to sort of get 9 million people back on their feet. We're not just going to sort of suddenly throw open the doors and restart America with a sort of, a better sense of I should drive less so I pollute less, or, oh, I don't need to go out and get these things. Again, those are kind of questions that are answered from a place of privilege.
Yes, go ahead.
Yeah, I think what happens the day after is going to significantly depend on what we do now, right? My hope for the first day that we're all allowed to be back in physical proximity, if I'm quite honest, would be a general strike, would be like the entire country coming together to demand with force and power that this not be used as an opportunity for neoliberal right-wing retrenchment, and actually be used as a possibility to recognize our shared humanity and shared vulnerability in a highly precarious system that values us only for what we can produce rather than for who we are. But I think that possibility of mass scale social movement against the forces that have created this distribution of vulnerability, which is highly unequal and highly oppressive, really depends on how we use this moment, in the midst of this crisis, to push for a world in which that's possible, to push for measures that reduce the immediate casualties and the immediate vulnerabilities that people are facing, and that strategically use this time in order to ally with others in communities in order to take care of each other so we survive long enough to be able to stand in the street and shut down the world. And I'll just say that my experience living in Chicago is that there have been massive citywide mutual aid networks of human beings who have never been involved in non-hierarchical bottom-up organizing, who are taking it upon themselves as communities, and not only, and not even primarily in the most sort of upper class parts of the city, to provide for each other, to redistribute wealth and stimuluses, to redistribute food and diapers and baby formula across the city in a way that feels really unprecedented. And so I think it's hard to tell what will be the day after, but my hope is that the sustained connections and resistance and sort of crack in the neoliberal ideology that I think many people are experiencing as a result of this crisis may be used as the basis for a real, powerful, bottom-up social movement to change the world that we live in following this crisis.
Thank you. I think we need another webinar with some actions, suggested actions of what needs to be done. Yes.
Oh, I'm into that. I could do that. I'm into that.
I want to, if I could share.
Justin, go ahead.
Yeah. I think one of the things that this self-isolation has taught us is the importance of friends and family and relationships, for sure. The way that I see this is sort of this, well, first off, none of us know what the day after looks like. And of course, this is also from our positions of privilege. I'll say that as we're reminded. But I think of this sort of dual transformation of society that what Ashley talks about, that there's this need for this sort of external social change, right? How do we change the society in which we live? Some of the points that I've been pointing towards, and also Richard and also Kat, is also this idea, and also I'd say actually all the panelists, is that there's also this internal need for transformation. And I was struck by what Richard had mentioned, which is how do we use less? What are the things that we can use less of? And when we think of material realities, the less we use, the more we have of it, right? But when we think of internal realities, the more you use something, you actually gain the capacity to use it more. So for instance, in the example that was previously given, you have these community members who are coming out of kindness and solidarity, and they're giving of their time and they're giving of their generosity. And by doing so, you actually gain more capacity to be generous, right? When we use trust, the more you use trust, it doesn't get used up. You actually gain the capacity to use more and more trust. So I think that there's a really interesting thing that could be happening as we all sit in our own prospective homes, where yes, materially, we have to figure out how do we find balance and how do we transform the world that's more just. But internally, we have this other opportunity, which is to say that when we draw from the sources of human capacity, we actually become stronger human beings, and we become more brave, and we be able to see those horizons more clearly so that we can have that dual transformation. But I think there's definitely an internal part that opens up an opportunity for all of us to think about what is that day after.
Thank you. Thank you very much, Justin. Thank you, Ashley. Thank you, Drew. And thank you, Kat, for your contributions to this conversation. It was interesting for me. I hope it was interesting for the more than 100 people that joined us for this conversation. I hope we are able to have more of these conversations in the near future. And I do hope and look forward to the day after, and for real structural change that, as Ashley and Justin suggested, and others as well, in fact, work needs to actually start today in order to make this change the day after real and lasting. So again, thank you from wherever you are, and I wish you all the best. Be safe. And I hope to see you all in our next conversation about that is relevant to this crisis, these awkward days in which we all live. Have a good day, afternoon, wherever you are.
Thanks everybody for attending.